All right, let's just dive right into this explainer. Today, we're looking at something absolutely crucial, how AI is literally stepping in to solve a life or death crisis in the behavioral health sector. But before we get into the tech, the integrations and the data, we really need to ground this in reality. To fully grasp why this matters so much, we first need to hear a deeply personal story. Dave Seil, the founder of Blueshirt Media, puts it incredibly bluntly. He said, "I reached out for help. I didn't hear back, and I kept using." Wow. I mean, that is a powerful hook, right? Dave actually built his company because he was once a so-called dead lead sitting in someone's CRM. He's in recovery today only because someone, eventually, picked up the phone. And that harrowing personal experience, that's exactly why he built a system specifically designed to reach the people that everyone else just kind of gave up on. So that brings us to part one, the dead lead crisis and the systemic flaws in behavioral health. To really wrap our heads around this massive systemic issue facing treatment centers today, we need to clearly define what a dead lead actually is. Because, look, this isn't just some marketing jargon. In this industry, a dead lead is a person in crisis. It's someone who called once, or maybe they filled out an intake form at 2 a.m. in a total moment of desperation. They got added to a CRM, sure, but they never got a follow-up, and they just disappeared. We have to remember that behind every single one of those digital entries just sitting untouched in a database, there's a real human being who actively asks for help. Months go by, some relapse, some don't make it, and the treatment center never even knows, all because that follow-up simply didn't happen. So why doesn't that follow-up happen? Well, it boils down to what we call the admissions dilemma. On one hand, you have admissions teams juggling urgent, live crisis inbound calls. On the other hand, they're supposed to be working cold outreach lists to follow up with older contacts. The root cause here is actually really simple. It's human bandwidth. You just can't expect an admissions team to effectively work cold, inactive lists while they're simultaneously fielding live, emotionally draining crisis calls. It's an impossible balancing act. And unfortunately, the cold list, that's always the thing that gets left behind. Which leads us to section 2, a founder's personal motivation and building a dedicated AI solution. Because Dave recognized this gap firsthand, he built a solution specifically to bridge this tragic divide. And it's actually the only AI platform built exclusively for addiction treatment centers. Now, I really want to point out that this isn't just some generic, off-the-shelf automated answering service. No, this is a highly specialized AI platform purposely designed for the really unique demands of behavioral health. It handles inbound call answering, missed call text backs, and, most importantly for our explainer today, outbound lead re-engagement. Let's just quickly touch on the tech foundation here, because to work in healthcare, security and seamless integration are absolutely everything. So this system is 100% HIPAA compliant. We're talking business associate agreements, encryption, full audit trails, the whole shebang. It gives you 24/7 coverage, meaning a call is never missed, and it supports callers in English, Spanish, and Russian. But here is the real game changer for operations. It plugs directly into a center's existing workflow without adding a single ounce of internal workload. It just integrates right with industry standards like Kipu, BestNotes, Lightning Step, Salesforce, and HubSpot. All right, moving on to section 3, the AI re-engagement framework, going beyond rigid scripts. Now, having the tech is one thing, right? But how the conversation is actually executed is a whole different ballgame. And what's really fascinating here is the framework itself. The AI is built on how people in crisis actually talk, not some rigid robotic script. When a lead replies, the AI naturally addresses those heavy, common objections. It handles cost concerns, it answers insurance questions, it gauges if the person is actually ready, and it can even navigate conversations about a patient's past bad experiences with treatment. So it's not just, reading off a menu. It actively keeps the conversation going in a super empathetic and relevant way until that person is ready. Let's jump to section 4, recovering 5,000 inactive leads through a multi-site case study. It is one thing to talk about this tech in theory, but let's see how it actually performs out in the real world. We're going to look at a massive case study involving a multi-site behavioral health organization. They had 5,000 dead leads just sitting completely inactive in their CRM. Let's walk through exactly how this AI campaign went down chronologically. Step 1 was A to P10 DLC registration. I know that sounds highly technical, but really it's just the mandatory carrier compliance process for healthcare messaging. And they got that approved and ready to go in just 1 week. Step 2 was phase 1 of the outreach. This was a zero-pressure, HIPAA-compliant, open-door text message. Literally no hard pitch. Then step 3 was phase 2, which was a follow-up text, specifically for the folks who didn't respond the first time. And why do that? Well, like Dave Seal notes, people in crisis absolutely deserve more than one chance to respond. That brings us to our final section, Section 5, Real Conversations, Real Admissions, Data as Triumph. When you look at the results from this 1-month campaign, the difference is just stark. We aren't just looking at abstract marketing metrics here. We're talking about real conversations and potential lives saved. To put it into perspective, the industry benchmark for healthcare SMS re-engagement usually hovers between 5 and 12%. Blueshirt Media, they hit a 22% engagement rate. They nearly doubled the industry's highest possible benchmark. And keep in mind, they pulled this off on contacts that had already gone completely cold.
And out of that massive pool, a truly crucial number emerges: 25. 25 individuals were successfully engaged by the AI, worked through their initial hesitations, and were transferred live directly to the human admissions team to start their intake process. That is 25 people brought right back from the void.
On top of that, the campaign generated 5 deep conversations. Now, in this context, a deep conversation means it lasted over 5 minutes. And in the behavioral health space, a 5+ minute conversation, that's considered the highest intent signal possible. The AI successfully held these deep, really meaningful dialogues, perfectly prepping the individual for a live human transfer. But beyond those direct admissions, there was this massive operational benefit too. The campaign processed 450 automatic unsubscribes. I know, in traditional marketing, that might sound like a negative, but here, it's a huge win. It permanently cleaned the CRM of dead numbers and people who just aren't seeking help anymore. That saved the admissions team countless hours of wasted effort down the road. Ultimately, the client confirmed that this single 1-month campaign completely paid for itself. So, as we wrap up this explainer, I really want to leave you with a provocative question to chew on. How many people who asked for help are sitting untouched in your CRM right now? It really forces us to reflect on the true human cost of inactive leads, because every dead lead is a broken lifeline. But as we've seen today, structured, empathetic AI actually provides a real, measurable way to reconnect those lines, clear out the static, and finally answer the call of those that everyone else gave up on.